hyperresonance. Treatment for COPD. Somebody who is having problems, not taking any medicine, having shortness of breath, early morning sputum productions, how do you help? If they're having shortness of breath, obviously you're gonna tell them, use a rescue inhaler. That's for, asthma and COPD. They have to have the rescue inhaler, which is short-acting beta agonist, SABA. Okay. After SABA, if they're taking SABA, but their symptoms are getting worse and they need something, like every day they're having symptoms. So we want to help them. We want to give them something that's going to help them on daily basis. Long-acting medicine. That is COPD. Remember, COPD is an umbrella term. Okay, under COPD umbrella, we have bronchitis, we have asthma, we have cystic fibrosis. It's just a umbrella term. Okay, so it's mom of everything. So that's why for COPD patient, we give them LAMA. Remember M for COPD, first select M, LAMA. Okay, once you give them LAMA, then baby comes in the picture. Okay, so after LAMA, you give them LABA. If LABA doesn't work, they still having symptoms are getting worse. Then you give them ICS. This is, this chaps, it works. This is how you remember this. First, they have to have SABA. It's, as needed treatment. It's not daily basis. As needed. When they need it, they take it. Okay. SABA. After that, daily medications. Give them mama, okay, which is LAMA. Then baby comes in the picture, LABA. Then ICS. Then refer them to pulmonologist. Then we have asthma. A couple of silent symptoms. Wheezing, that's the main one. Okay, they have recurrent wheezing going on. Recurrent wheezing. This is how we identify that they have asthma going on. Recurrent wheezing. So we have intermittent asthma and we have persistent asthma. Persistent has mild, moderate, severe. Okay. Normally, when patient has wheezing going on, what do? We want to help them right away. We give them, short-acting beta agonists, help open them up, and that's it. Somebody who is suffering with asthma on daily basis, like daily basis means like they're having something going on. Like in 1 week, they have symptoms of like 2 days, they are wheezing. They have asthma. Not once in a while they are having flare up. Every week they have symptoms going on. So what do? What is the first choice of treatment for asthma? ICS, we start with inhaled corticosteroids to calm down the reaction or response of asthma. So inhaled corticosteroids. Inhaled corticosteroids. After that, if they are having, still asthma, like every day, now they are having symptoms daily. Then we add baby, LABA. After LABA, what do? They still have asthma, like daytime, nighttime symptoms, 24/7 asthma, coughing, wheezing. What do? Then we add oral steroids. And at the end, we refer them. So remember, when they tell you daily symptoms, you add daily LABA. Okay. If you see the word daily, then you add daily LABA. Okay. If somebody has been exercising and they have asthma, and when they exercise, they are having asthma flare up. And because of that, they cannot exercise. So how do you help them? You advise them, take your, short-acting beta agonist 15 minutes prior to exercise. So SABA, you know how long it's going to take to work? 5 minutes. It's going to be in their system within 5 minutes, and it's going to start helping them. That is short-acting beta agonist. So 15 minutes prior to exercise, and then they're going to be okay. So this is how it goes for asthma treatment. Short acting, only when they need it. Routine choice of treatment, first choice of treatment for asthma. We start with low dose ICS, then we add LABA. After that, we add steroids, and after that, we refer them. Another way of remembering treatments. COPD, we go from left to right. Mama, then baby, then ICS. For asthma patient, we go right to left. ICS, then baby, then LAMA. Okay. In the exam, if you don't have LAMA option, then you select oral steroids and then you refer them. Then we have pneumonia. So here we have, 3 different categories, right? But actually in the healthy categories, we have 2 different patients. That makes it 4 separate patients. Okay. So healthy patient, we have 2 of them in there. Young patient, healthy patient. Okay, young and healthy. No comorbidities. And the other one is a little bit older, but he's healthy, no comorbidities. That's why we have it in the first group. Those are healthy group. Young patient, healthy patient can walk into the McDonald's. Okay. Middle-aged patient but healthy can still walk into the McDonald's. So choice of treatment, if they have pneumonia, is AMD. McDonald, AMD, macrolides or doxycycline. Now we're going to talk about the signs and symptoms. Young and healthy patient don't know what's going on. They have walking pneumonia, they're walkie-talkie, they don't have a whole lot of symptoms, they have gradual onset of fatigue. That's the main sign and symptoms. It all finds out when we order X-ray. X-ray shows patchy infiltration. They have non-productive cough. X-ray shows patchy infiltration. How do we treat? Macrolides or doxy. Okay, another patient. Middle age, somewhere between 60 years of age. Okay, healthy patient, no comorbidities. That person actually has high fever. Okay, that person actually has rusty color sputum too. Choice of treatment is macrolides or doxy because it's healthy. Remember, any healthy patient, you give them macrolides or doxy and they'll be fine for pneumonia. Problem begins where we have sick patient. Okay, sicker patient, immunocompromised patient. They have splenectomy, they have diabetes, they have kidney disease, they have liver disease. Then macrolides and doxy, they're not going to be able to walk into the McDonald's, right? That's where we give them levofloxacin, which is broad spectrum antibiotic. Respiratory fluoroquinolone. Fourth patient, old patient, sick patient. They are confused. Their respiratory rate is high. Their blood pressure is low. They are dehydrated. When somebody has, how do we know that this person is getting dehydration? How do we know? Their BUN, their burn goes high. That means they are dehydrating. So this person is old patient, sick patient, confused, blood pressure low, and all that. Multiple lobes are affected in their lungs. We're not going to be able to treat them as an outpatient. Refer them to the hospital, admit them. Okay. Acute bronchitis.